Now I want to actually look at a set of rules, and these rules actually guide uh, the exposure of patients towards all those radiation, X-rays, CT scans, MRI. Do you understand? So these rules are like a guideline to this, you know. So they call them the IRMER. IRMER. Okay, that's ionizing radiation medical exposure regulations. You know. So what we have here, they're actually laws made by the United Kingdom government, but they apply worldwide though. So they govern the use of what ionizing radiation in medical settings, ensuring that what the patient is what at the center of everything. Everything is to the advantage of the patient. Okay, and anytime you're exposing a patient to exposure to the radiations, it should be properly justified. Okay, the reason why you want to actually do such a thing should outweigh the side effects. Do you understand? So purpose of this is to protect patient from unnecessary or excessive exposure to ionizing radiation during medical procedures. It covers all medical uses of radiation, MRI, CT scans, dual energy, X-ray, absorptiometry, you know. So that's what we got. So latestly, the laws were actually amended in 2024. I'm recording this video in 2026 in case you are watching it later on. Probably I'm dead. Alright, so key principles is justification. So every medical exposure must be justified by weighing clinical benefits against radiation risk. You know, only authorized practitioners should approve exposure. So optimization. So you know, radiation dose must be kept as low as reasonable practicable. Okay, so use of modern equipment and dose reductions. The center of this is what I want to expose a patient to radiation. My reasons for exposing this patient to radiation should be more than what the side effect that the patient will have later on. It should be for the best of the patient. Okay, so if it is a disease condition that I can always diagnose without involving radiation, I shouldn't expose area. And of course, radiation is expensive, so you always look at all of that, you know, and your patient will always get the best treatment. So it covers the responsibility of duty holders. So employers should ensure the compliance, training their staffs very well, and make sure that the equipment are always in good operation state. Practitioner now should make sure that anytime they are exposing a patient to radiation is justifiable. When a court case is filed against you, you can be able to defend yourself. The operators will carry out the procedure safely, none of that. So accidental or unintended exposures must be investigated and reported to the Care Quality Commission. Okay, so the laws though are mostly, you know, practiced in England, Scotland, Wales, and Northern Ireland. Okay, so legal requirements is training. So all staffs there should be really trained very well. Record keeping. So once you expose somebody to radiation, you keep good records, you know, and have regulatory bodies. And patient information should always, patient information, right? So patients should always be explained about the risks and benefits, right? And the patient should always accept a particular, you know. So the doctor is not taking a unilateral decision. The patient has to actually contribute to.